Hello, friends. It has been quite late today, but I thought I will start my leading characteristic series too. Just yesterday, I started my series on brief talks with Aconite. So today also, I will continue with Aconite, the first part of my leading characteristics. In this series, every week I will be talking with one drug, and I will be presenting the leading characteristics of each drug. There can be many symptoms in the materia medica. Each drug has many symptoms in the materia medica, but what are the leading symptoms? The leading characteristics that confirms a case to be of that remedy. I will try to cover them. Today in the first episode, I will just continue with Aconite since I started yesterday with Aconite in my brief talks. So I told yesterday that Aconite is an acute remedy, but not necessarily. Even in many chronic cases, aconite can be found useful, and it has shown results when the doctors have recognized that yes, this case needs aconite. Their aconite has shown good result even in chronic cases. But that onset and the causative factor was there. So that is first leading characteristic of aconite is sudden onset. Any case, whatever problem it comes, in the acute condition, sudden onset must be there. The patient was fine, all of a sudden a headache started, severe headache. Or he was fine, all of a sudden he came down with fever, severe fever. So along with sudden onset, there will be a severity, a intense symptoms. The disease onset will be severe or violent or very intense. So this is number two. Number one sudden, number two is severe or violent. It can be anything: a headache, a toothache, patient comes to the chamber, all of a sudden he was working, all of a sudden he's got a toothache, suddenly, and a very severe pain, and it is so awesome that makes the patient anxious. He becomes very anxious, and there is fear of death. Actually, the severity of the attack of the disease makes the patient very afraid. And there is in aconite, the disease has congestion and affects the circulation, blood circulation so profoundly that the patient thinks that what is happening, and he becomes really anxious and worried, and that you can see on his countenance, on his facial expression, anxiety will be seen. And the patient will say, "Doctor, do something, or I will die." Or he may also say, "Doctor, I am going to die. What will you do by medicines? No need to give medicines." So, this is what actually he has a fear of death. So, number one was sudden onset, number two was violent or severe in intensity from the very beginning. Number three, there will be awful anxiety expressed on his face. And number four, fear of death. And due to anxiety, there will be restlessness. Sometimes the patient may cry, weep. You don't know why. Whether he is in there is any grief? No, not grief. He is weeping because of due to anxiety. Sometimes he will throw things, very angry, or he will be just restless, and will along with that there will be a uh, fear of death. And the fifth one, there will be intense thirst, thirst for cold water. We have here aconite. We have found thirst, intense thirst in bryonia, but bryonia generally, when we see the patient say, "No, I am thirstless," for a long time there will be no thirst, and then after a long time, the bryonia patient will feel intense thirst, thirst for large quantity of water. But here in aconite, again in arsenic, we see that frequently the patient will ask for water, but he can't drink much, just one or two sips. Then again, after a few minutes, again one or two sips. That is also, arsenic also has severe anxiety. Aconite also anxiety, and due to that, there will be thirst, but for large quantity of water and cold water, and there will be restlessness due to this anxiety, fear. There will be thirst, and this restlessness also comes due to congestion. We find congestion in the getting, suppose in the brain, congestion in the brain, congestion in the cardiac heart, and there can be any organ, any whatever organ is affected, whatever complaint the patient comes, whether it is a simple cold, a severe headache, fever, it can be pneumonia, and very sudden attack of pneumonia, severe, with this intense fear, anxiety, and thirst, or a simple colic, or an attack of diarrhea, cholera, or a in, inflammatory effect of the eye, earache, anything. Now, another thing is, along with these five characteristics, sudden, violent, awful anxiety, fear of death, intense thirst, another thing is you have to remember that what are the causative factors. Now, these thing, everything is, we find that in aconite a shade of violent and severity. Now, these patients are generally found very robust constitution. Only we, if any feeble constitution patient, I don't think we will hardly get any such patient to have symptoms of aconite. Aconite is generally expressed in patients who are robust in their health, in their or plethoric in people, the plethoric or robust people. Generally, and the climates also, we find aconite more common in extreme climates, places with extreme climates. Like in India, we find go to northern Punjab, Haryana, Delhi, even Rajasthan or Gujarat, extreme heat, or places like Himachal or Punjab where extreme cold, we find aconite patients more there. And places like Bengal, where the climate is not so severe and humidity is much, we may find, of course, there can be aconite patients here, but generally less patient we find in these regions. And another thing, the causative factor of aconite, as I told, that will be exposure to severe cold, exposure to severe heat of summer, and dry cold and dry heat. We know Thuja occidentalis, they suffer or they are aggravated from exposure to moist cold. Aconite patients get sick from exposure to dry cold and extreme dry cold, dry severe heat, working in the sun, under the sun during summer in a very dry places. A person of vigorous constitution generally do not feel sick, but due to that severe exposure, he comes down with a severe headache or a fever. That is aconite. We will think that such cases they express, they give symptoms of aconite. So these are the things we must remember, the causative factors. And another, as I mentioned yesterday in my brief talks, that fear. Many a time, many complaints arise from fear. Sudden heart cardiac pain or sudden fever or colic, abdominal colic started from fear, extreme fear. So these are the causations. And the five cardinal symptoms: sudden onset, severe of onset, anxiety, fear of death, and violent thirst. So this is Aconite. Thank you so much. I will be up with next another medicine next in the next episode.